Hi guys, it's James from Vets of Geelong, and this month our focus in the clinic is on lumps and bumps. Now lumps and bumps are a funny one insofar as some people stress and some people don't. And the classic scenario for us is they come in the consult room, they say, can you check this out? I'm not worried about it. But sometimes for the vets, you see a lump and it looks innocent. We don't know what we're dealing with, not as a client. Other times they come in and they've got multiple lumps. And again, sometimes they are generally quite innocent and they become more of a cosmetic nuisance rather than a sinister type lump. And it's often hard for us to tell. So we often recommend doing a fine needle aspirate, and that's probably the starting point for a lot of lumps. Putting a needle in, getting some cells, and then seeing what's happening underneath the surface. By doing that, sometimes we can reassure you specifically what your pet might have. And it could be for some lumps, we're just going to monitor it because it is an innocent lump. And it could be next time your pet's in for a procedure, we remove it then. Other times there might be circumstances where we have a lump by itself and it's a bit sinister and we have to do something about it. And in those circumstances, often what we might do is do a fine aspirate check and or remove the lump. And sometimes that fixes our problem. And you often can't judge a book by its covers. Other times people come in and they've got a whopping big lump. And it's not necessarily a bad lump, it just becomes a space occupying lump. And it might be in the arms or the groin or on the back. Some of those lumps, again, we might check them and it could be we're removing a lump because of, I guess, annoyance to the pet or because it's getting quite big and large. And so sometimes the biggest lumps aren't the bad ones. Other times we get in a situation where the pets come in, they've got a little lump all by itself. We do a check and it's a high-grade aggressive tumour. So I guess ultimately what we're saying is if you've got any lumps and bumps, it's worthwhile to get them checked because you don't know any more than we do sometimes by looking at lump what's happening under the surface. There are some lumps which show classic patterns which would alarm us as vets, which might mean we're more inclined to act on them. But to play it safe, book your pet in this month if you're worried, get the team to check the lumps and we can work out what's happening. All the best guys and get those lumps checked. Bye.